Emotionally unstable personality disorder (EUPD) is a mental illness. Look at this picture, shows that emotional instability, detail going on. Introduction. Emotionally unstable personality disorder, also known as borderline personality disorder, is a mental health condition characterized by intense mood swings, instability in relationships, self-image and behavior. Individuals with EUPD often struggle with impulsivity and difficulty regulating emotions, leading to unstable interpersonal interactions and self-destructive behaviors. Definition. EUPD is defined as a pervasive pattern of instability in interpersonal relationships, self-image and affect along with marked impulsivity. This condition typically begins by early adulthood, occurs in various contexts, as outlined in the Diagnostic and Statistical Manual of Mental Disorders. Types. There are two main subtypes of EUPD. One, impulsive type, characterized by emotionally instability and lack of impulsive control, leading to outbursts of anger or violence. 2. Borderline type, primarily marked by disturbances in self-image, interpersonal relationship and intense emotional reactivity. Causes. The exact cause of EUPD is unknown, but contributing factors may include: 1. Genetic predisposition. A family history of mental health disorders may increase the risk. 2. Environmental factors. Childhood trauma, neglect or abuse are commonly linked to the development of EUPD. 3. Brain structure and function. Abnormalities in brain areas involved in emotional regulation, such as the amygdala and prefrontal cortex, have been observed. Risk factors. 1. Family history of EUPD or other personality disorders. 2. Childhood abuse or neglect. 3. Abandonment or inconsistent caregiving in childhood. 4. High sensitivity to stress or emotional reactions. 5. Co-occurring mental health conditions like depression or anxiety. Complications. 1. Self-harm, cutting, burning or other self-destructive behaviors. 2. Suicidal ideation and attempts. High risk of suicide in individuals with EUPD. 3. Substance abuse, common as a coping mechanism for emotional instability. 4. Relationship difficulties, intense and unstable relationship often lead to frequent conflicts and breakups. 5. Employment issues, difficulty maintaining a stable work life due to impulsive behavior and emotional instability. Pathophysiology. The pathophysiology of EUPD is thought that to involve disturbances in the brain emotional regulation system, including the limbic system, which controls emotions, and the prefrontal cortex, which helps in decision making and impulse control. Neurotransmitters like serotonin, dopamine, and norepinephrine are believed to play roles in mood regulation and impulsivity in individuals with EUPD. Here is a step-by-step breakdown of the pathophysiological process. 1. Genetic predisposition and environmental influences. Genetic factors, environmental factors. 2. Alteration in brain structure, amygdala, prefrontal cortex, hippocampus. 3. Neurotransmitter imbalance, serotonin dysregulation, dopamine dysfunction, norepinephrine. For emotional dysregulation, lower distress tolerance. 5. Impaired interpersonal functioning. 6. Chronic dysphoria and identity disturbance, chronic emptiness and unstable self-image, paranoia and disassociation. 7. Feedback loop, chronicity. The pathophysiology of EUPD involves a complex interplay of genetic vulnerability, environmental trauma, brain structure abnormalities, and neurotransmitters dysfunction, leading to the characteristics emotional instability, impulsivity, and interpersonal difficulties seen in individuals with the disorder. Signs and symptoms. 1. Emotional instability, rapid mood changes with episodes of anger, depression, or anxiety. 2. Fear of abandonment, extreme efforts to avoid real or imagined abandonment. 3. Unstable relationship, intense but short-living relationship with alternating extremeness of idealization and devolution. 4. Unstable self-image, a distorted sense of self or identity, leading to sudden changes in goals, values, or career plans. 5. Impulsivity, reckless behaviors like spending, sprays, unsafe sex, substance abuse, or binge eating. 6. Chronic feeling of emptiness, persistent sense of being emotionally unfulfilled or incomplete. 7. Inappropriate intense anger, frequent outbursts of anger or difficulty controlling temper. 8. Paranoia or disassociation, short episodes of paranoia or feeling disconnected from oneself during periods of extreme stress. Medical diagnosis. Diagnosis of Eupd is primarily clinical and involves 1. Psychiatric evaluation through mental health assessment to explore symptoms, personal history, and relationships. 2. Use of DSM-5 criteria. At least 5 out of 9 specified criteria must be met for a diagnosis of BPD or EUPD. 3. Exclusion of other conditions. Conditions like mood disorders, schizophrenia, substance abuse must be ruled out. Nursing diagnosis. Common nursing diagnosis for individuals with EUPD include 1. Risk for self-directed violence. 2. Impaired social interaction. 3. Chronic low self-esteem. 4. Ineffective coping. 5. Anxiety. Management. The management of EUPD requires a multidisciplinary approach. 1. Therapeutic interventions. Psychotherapy, especially dialectical behavior therapy, DBT, is the cornerstone of treatment. 2. Medications. No specific drugs are approved for EUPD, but mood stabilizers, antidepressants, or antipsychotic may help manage co-occurring symptoms like depression or impulsivity. 3. Crisis intervention. Short-term hospitalization may be necessary during periods of acute distress or suicidal ideation. For support networks, family therapy, social skill training, and support groups can assist in improving interpersonal relationships. Treatment. 1. Dialectical behavioral therapy, DBT. DBT focus on teaching skills for emotional regulations, mindfulness, interpersonal effectiveness, and distress tolerance. 2. Cognitive behavioral therapy, CBT, can help challenge negative thought patterns and behaviors. 3. Schema focused therapy addresses patterns of thinking and behavior formed in childhood. 4. Medications. While no medications are approved, specifically for Eupd, antidepressants, mood stabilizers, example lithium, and antipsychotic can help alleviate symptoms like mood swing, anxiety, and impulsivity. Psychosocial medicine. 1. Psychosocial intervention support in building social skills and maintaining stable relationships is key. Vocational relationship and life skill programs can help improve functioning in daily life. 2. Family therapy. Involvement of family members can help in understanding the disorder and improving communication patterns. Prevention. Preventing Eupd challenging due to its complex causes, but early intervention for at-risk individuals, particularly those with traumatic childhood experiences or family history of mental health disorders. Can help mitigate its development, promoting healthy coping mechanisms, emotional regulation, and stable social environments may be preventive. In conclusion, Eupd is a severe and complex personality disorder characterized by emotional instability, impulsivity, and disturbed relationships. It presents significant challenges in terms of diagnosis and management, but can be effectively treated through combination of psychotherapy and medications and psychosocial support. Early diagnosis and intervention along with strong support systems can improve outcomes and quality of life for affected individuals. Thank you. Have a good day.